Okay, we'll go ahead and get started. It is January 11th, 2022. Happy New Year, everyone. We're here today for the year's first Citizens Law Enforcement Review Board monthly meeting for the County of San Diego. First on our agenda tonight, I would ask Pastor Spriggs to call roll.
Happy New Year. Can you hear me?
Yes.
Okay. Roll call as follows. Susan Youngflesh.
Here.
Eileen Delaney.
Here.
Pastor Robert Spriggs Jr. I am present. Buki Domingos.
Here.
Nadia Keen Ayub.
Here.
Bonnie Kink.
Here.
Marianne Pintar.
Here.
Tim Ware. G.I. Wilson.
Here.
That concludes roll call.
Thank you, Pastor Spriggs. I'll move on to agenda item number 2, public comment. Mr. Parker, do we have public comment tonight?
I have 3 requests to speak, and I will attempt to move them over myself. Actually, I have 4 requests to speak. First off, we'll start with Darwin Fishman. Dr. Fishman, are you there?
Yes, I'm here. Can you hear me?
We can, and your 3 minutes to address the CLERB starts now.
All right. Thank you. Good evening. I want to thank you first for the work that you've done. And as you know, of course, you get a lot of scrutiny, so I appreciate the press coverage. And I think that the article about the sheriff deputies and the way that they handle a situation with seeing someone that was in medical distress was improper procedure and policy. So I appreciate you guys doing that work. And again, I know behind the scenes how difficult it is, and the press coverage makes it look very easy. And we definitely want to come and support in terms of Racial Justice Coalition and North County Equity and Justice Coalition to support you with that and to continue on that path. Unfortunately, we're still hearing about excessive force and a high amount of people still dying in custody. And so we're going to continue to push on that until we really see substantial change. And that's certainly our biggest concern in our community, especially with how people are treated in custody. So I wanted to thank you for your work. And we're looking forward to working with you on projects as you move forward, especially with the new racial profiling committee that you're going to be setting up, as well as also highlighting things like the report from CPE. So we're looking forward to that. Thank you again for your work.
Thank you. Next, we will go to Andy McLeod. Ms. McLeod, are you there?
Hi, can you hear me?
Yes,
Hello.
we can. Your 3 minutes to address the CLERB starts now.
Okay. Well, every month I show up to the CLERB meeting and find it fascinating and heartbreaking and a source of pride in my community that there are people like you who want to step up to deal with these these complaints that are difficult to process and assess, and for which, as far as I can tell, you get very few kudos in the majority of the community. Every month, the deaths weigh on me that I see in the jails. And every month when I see the CLERB's review of those deaths, my heart breaks again a little bit. This month's review of the complaints reveals yet again the need for reform in the Sheriff's Department. We know that inmates have died because of a lack of response from law enforcement. And we know that one person actually injured themselves, taking out their eyes, while a deputy just stood watching. This is just a level of, I don't know what to say, incompetence, uncaring, of a culture that gone wrong. Maybe it was never right. I don't know. For instance, in this report, the deputies that were mandated to respond to Anthony Tron's medical condition failed in their mission. And I felt very strongly that it wasn't just that day where he was lying on the ground dying after being taken to the recreation yard after he'd been identified with a medical problem. That was one part of the problem, but for 3 days prior, he reported medical distress. It was how much medical distress does it take to be checked out by health professionals in a hospital outside the sheriff, outside the jail? It took the fourth and fatal episode before he was transported. I think that's just a little bit late. And like so many things, I think about the humanity of the people involved. So what if they're mentally ill or addicted or have been homeless? They're people worthy of dignity and respect. I'm very glad that you are asking the hard questions more and more about the CPE report. I'm and about the manner in which people die. But I do feel that the reform, I feel that you need more powers. I feel that very strongly. And I also feel that the change has to come in concert with you. The district attorney has to use their powers to prosecute people like the deputies involved in Sean's death. And the sheriff's department has to be willing to work with this. And I'm very eager to hear the report in April from the audit of the sheriff. And in the meantime, I just want you to know that I'm a citizen that once having been alerted to this, I personally am just not going to rest
Ms. McLeod, unfortunately, your time is up.
Until change is effective. Thank you.
Thank you. Next up, we will go to Yusuf Miller. Mr. Miller, are you there?
Yes, I am. Can you hear me?
We can hear you, and your 3 minutes to address the CLERB starts now.
Okay. As we all know, the audit is entering its completion of the investigation of in-custody death in San Diego County, and we look forward to a breakdown and a sort of help the community to understand what these reports may mean. A lot of times reports come out, they're complicated, and they're hard for the community to digest. So we're really looking forward to this report hitting the streets, and when it does, we hope that CLERB will support us in grappling with this detail, the actual report and what it says and what it means to us as a community. The entire community is waiting with bated breath on this issue, and we want to support that, support our understanding so that the narrative is correct. In a segue to that, the report, CLERB report that just came out, that just hit the streets, although I applaud its charts and its graphs and things like that, which are very helpful and useful, there are some other points where it's hard for the community to actually digest. We have a case number and not much else that we can tie to a department or a particular station. That's important to us because we would want to know if it's our particular station that has so many complaints that are, for example, sustained. Everyone would want to know, is that station in my backyard? So we would like to see, take that into consideration, and hopefully CLERB is willing to do a breakdown for the community so that they don't have to be experts in what these things say, what they mean, and how to digest them. I definitely applaud the approach to the CPE report, where we have some ad hoc committee and all other people working on this to come up with some solutions, some actually policy change that will translate into something tangible that we could dissuade any officer, any deputy from making these kinds of situations where people have to complain. So we know that they 100% will not be changed, but there is a huge amount of avoidable and discretionary tactics that should not be used that are being used, and hopefully it could drop that percentage by a lot. So we thank you for what you're doing, and we hope that you help us in understanding and breaking down this information. Even without this information, our community relies on us to break it down for them. I would rather you help us with the narrative instead of us having to take the narrative ourselves. Thank you.
And thank you. Next, we will go to David Myers. Mr. Myers, are you there?
Can you hear me now?
We can hear you now. Your 3 minutes to address the CLERB starts now.
Thank you, Mr. Parker. Good evening, members of the board. Thank you very much. Just some things I want to bring to your attention to ensure that when you are presented with certain facts or figures that you have something in your ammo box to ask questions about. You know, right now the department, I got a text from a deputy sheriff this morning that said that they are conducting off-site training away from the Miramar College because the COVID restrictions at Miramar College are too restrictive. And they're currently sitting at an indoor training facility at Otay where they're mixing mandatory vaccination deputies with deputies who work in the field who are not required to have mandatory vaccinations. And so it's inconsistent. And then deputies that work in certain facilities, whether it's a courthouse where there's mandatory masks, it's not being adhered to at a offsite away from the police academy training site where it's less restrictive. And so also you're going to be seeing lots of reports coming at the Center for Police Inequity Study. You're going to talk about the JLAC report, which should be coming down. I ask that you look at all these reports from a global perspective and not in silos based on the reports that you receive. And, you know, we are seeing tremendous lack of oversight and accountability within so many different aspects of the department. And I know that CLERB's role is expanding, and I greatly appreciate that. And these are just some things I wanted to bring to the board's attention. And you have an important role ahead of you, and the public is looking to see what's going to happen. So thank you all very much for your time.
And thank you. Next up, we will go to Mary Best. Ms. Best, are you there?
Yes, I am. Can you hear me?
Can hear you. You're good to go.
Thank
Your
you.
3 minutes starts now.
Yes, my name is Mary Best. I'm a resident, a therapist, and a very proud member of Racial Justice Coalition. I've seen the CPE report. I agree the statistics, digesting it and making sense of it. I'm not good at statistics, but what I was really aware of in some of those glaring statistics was the inequities in policing in the sheriff's department that really harms lives of people of color in our community, that kind of erode and damage that public trust and public safety that we're advocating for. And I guess the statistics that really jumped out at me was that use of force. You know, 4 times more on Black residents than whites. Black residents stopped at rates of 11%, though it was only 4.9. They're only 4.9% of the population. And that the report seemed to be really clear on what needed those next steps. And I would ask that the board really press that the department, Sheriff's Department, take those next steps to ensure accountability, that they really actively investigate situations where there are disparities, and they follow up with actions by identifying risk factors and targeted interventions and improved written policies and all the things that were really spoken to in the CPE report, but that I think also providing leadership in the Sheriff's Department for a climate of change to be really possible, and partnering with the community, this community, to develop target interventions, those that are most impacted. So thank you so much. And I appreciate very much the work that all of you are doing. Thank you again.
And thank you. Next, we will go to Robin Sales. Ms. Sales, are you there? Ms. Sales?
Unmute. Can you hear me now?
We can hear you now. Your 3 minutes to address the CLERB starts now.
Good evening. I feel like a partner with you for the past 14 months that our Racial Justice Coalition group began attending your meetings. But looking at the Sheriff's Department use of force policy update included in the board packet, I have concerns about the statement, quote, de-escalation does not require that a deputy risk their safety or the safety of the public, as here lies the intersection of bias, police culture, and the rights of Black and Brown residents who encounter the police. It is especially pertinent in dealing with vulnerable populations as identified in the use of force guidelines. As a member of the Behavioral Health Advisory Board and a retired mental health clinician, my concern is to prevent tragedy related to a perceived fear of the deputy involved. Since the CPE report highlighted the disparities in use of force with BIPOC, LGBTQIA, and disabled populations, I want to know how bias is measured in deputy responses to these groups. I applaud the CLERB for strongly requesting that the Sheriff Department come up with an action plan to address the CPE concerns. I read in Sheriff Gore's response many justifications for why the CPE report is erroneous, as he did with the Campaign Zero report in the past. There is no end to the obfuscation by Sheriff Gore and his administration. With the JLAC report coming in the next few months regarding deaths in custody in the San Diego County jails, it is so important to continue to question longstanding police policies that do not work and which cause needless loss of life. Please know that the community appreciates you. Thank you.
Thank you. Next, we'll go to Lori Saldana. Ms. Saldana, are you there?
Good evening. Yes, thank you, Director Parker, and good evening, CLERB members. It's been a year since it was suggested that the state audit agency take a look at the deaths in custody in San Diego, and the audit, according to the website, is going to be released as early as next month. And when I was in the legislature and requested similar audits, often they will give an early heads up to the requesting legislator, in this case, Dr. Akilah Weber. So I wanted to encourage your staff to be in contact with the Assemblywoman and maybe get some information ahead of time of the release and plan to do a special meeting focusing on the results and the findings of this audit committee or the audit agency. And also I wanted to just make sure that you understand that they're also evaluating the extent to which the Citizens Law Enforcement Review Board has provided recommendations to the sheriff regarding inmate safety and how you have followed up to determine if they've been implemented. So this audit is not only looking at the deaths in custody, it's really taking a broader view of how you've been able to be effective in having policy recommendations implemented within the department. They're also evaluating if your reviews of inmate deaths in 2017 had sufficient staff and resources so that you could do your work adequately. So I think this is an opportunity, and it's already been addressed to some extent, to ensure that you do have the support, the staff, the resources to do your jobs and improve on what has happened in previous years. So this audit is pretty comprehensive, and I think there are many in the community who are interested in the results. And since we're not able to go to Sacramento and review this or ask questions, please consider hosting a special meeting and inviting the participation of people in the community so questions can be asked and addressed over some of the findings when they are released. And I think it would be beneficial, and it would be important for you to hear, as well as for the community to ask those questions and hear your responses. Thank you.
Thank you. Next, we will go to Doris Bitar. Are you there?
Yes, can you hear me?
Yes, I can. And your 3 minutes to address the CLERB starts now.
Okay, I won't take that much time. I just want to commend the people who spoke before me. I agree with all of their points. I just want to make a couple of points. You have a very difficult job. There's pressure from all around. The police are resisting like it's nobody's business. And the pressure is tremendous. And but change has to happen. And it's on your shoulders at this point in time. The last meeting I went to was just before the holidays, and there was this long logistical conversation that was not content-based. It was just who can talk and how much can you talk about and what's the agenda and all of that. And I just want you to concentrate on having the meaty discussions that need to be had and not get mired in logistical stuff. I mean, unfortunately, from my point of view, it just sounded like people were being shut down. And I know it's right before Christmas, right before the holidays. So, but I want you to think generously of each other and also of those of us who keep showing up here. It's a very bad situation. Our policing has been compared to as being worse than Rikers Island in New York. And, you know, highest in custody deaths in the nation, on, people of color, especially Black Americans. But it concerns all of us. And we're all in this together, and let us know how we can help you. Thank you.
And thank you. Next, we'll go to Debbie Cantrell, or I'm sorry, Cortell, my apologies. Debbie Cortell, are you there?
Yes, I'm here. Can you hear me?
Yes, we can. And your
Okay.
3 minutes to address the CLERB starts now.
Okay, thank you. As volunteers, I know that your time is valuable and I appreciate that you all keep showing up. And I realize it is because that you believe in seeing the right things being done for the overall good of our community. And like you, oops, something muted me. And I will keep on showing up too, to ensure that the same thing. And I ask that in light of the recent studies, that you stay vigilant and intentional and focused on the needs of the community. When given the opportunity to do the least work, the most work, or work in between, choose the right work. Choose the option of doing what is best for the community at heart. Let's all continue to work together. Let's use the information that's been given. Let's lean in and let's create some actionable items with transparency and an objectionable lens that truly reflects the willingness and intent to be the stewards of the community to help all of us get to a better place. Thank you.
Thank you. Next, we'll go to Tasha Williamson. Ms. Williamson, are you there?
Can you hear me?
Yes, we can. And your 3 minutes to address the CLERB starts now.
Awesome. I had been reviewing the annual report and thank you for allowing me to speak, the annual report for 2020 from this CLERB. And I definitely have some concerns in regards to the charting of this report, and would hope that the CLERB and the staff of the CLERB would make changes. For instance, on page 16 and 21, it tells us the units, the jails, and the stations. But then when it goes to findings, it gives us case numbers. Those case numbers we can never request. We don't know what they mean. I'm just not sure as to why, and hope that they can change the report to show the findings which would relate to the units, the stations, and the jails, so that we can definitely, as layman community members, understand where these findings related to the same chart on 16 and 21. The findings, I believe, were on page 22, 23, and 24 of the report. It is easy for us to understand where the deaths are coming from, because it lists the station of the deaths on page 28, 29, and so on. So if you want this chart to flow and be easier, I'd hope that those changes could be made to the next annual report, so that we can be clear what units, stations, and jails that have had the complaints or the deaths that we see the same chart for the findings, so we can be clear what those findings were related to those complaints and allegations. Thank you so much.
And thank you. And next, we will go to the last request to speak that I have is from Dr. Brown. Bear with me for a second here. Dr. Brown, are you there? Dr. Brown, are you there? Robert Brown, are you there?
Yes, I am. I'm sorry. Can you hear me?
We can hear you now. Your 3 minutes to address the CLERB starts now.
It won't take 3 minutes, but I just want to let you know that I am very grateful for the work that you're doing, that I would like to volunteer as a citizen to help you with any challenges regarding data or information you may have, any challenges. How does someone, well, I guess it's on your site how to notify you about your availability. I didn't expect to really get an opportunity to speak tonight, so I'm not really prepared. But I just want to say to you that I am going to be joining more often to listen, to participate. And the one thing that I ask is that we really, when you have a report, a complaint, and for some reason I believe that you can get answers to whatever you want to. I just ask that we all understand that we live in volatile times right now, that everybody or everyone is full of anxiety and fear because of what is taking place in our country, in our society, that we remember that we all have a common positive, and that we really focus on the fact that it's important that we work together. And with that, I'm going to sign off, but I just want to let you know that thank you for giving me this opportunity to speak. And I'm looking forward to being a part of what you're about and helping wherever I can.
And thank you. And with that, Chair Youngflesh, I believe that concludes public comment.
Thank you, Mr. Parker. I will move on then to agenda item number 3, which is minutes approval. Do any board members have any revisions to the minutes from the last board meeting? Hearing and seeing none, then is there a motion to approve the minutes?
So moved.
I believe that was Ms. Kank, and I saw Mr. Wilson's hand as well, so I will take it as a move from Ms. Kank and then a second from Mr. Wilson, if that's okay. And then I would ask Mr. Secretary to call roll.
Pastor Spriggs, you good?
Oh, okay. Yes. Okay. I'm sorry. All right. Susan Youngflesh.
Yes.
Eileen Delaney.
Yes.
Pastor Robert Spriggs Jr. Yes. Buki Domingos.
Yes.
Nadia Keene Ayub.
Yes.
Bonnie Kink.
Yes.
Marianne Pintar.
Yes.
Tim Ware.
Yes.
And G.I. Wilson.
Yes.
Perfect.
Motion carries unanimously. Thank you, Pastor Spriggs. Moving on to agenda item number 4, presentation training. The first training that we have is a summary of Detention Services Bureau in custody COVID-19 vaccination and testing process by the San Diego Sheriff's Department Sergeants Kristen Brayman and Daniel Dennis, and I would turn the floor over to them.
Good evening. This is Sergeant Dennis with the Sheriff's Department Division of Inspectional Services, and I will be going over some information regarding the Sheriff's Department COVID testing and vaccination process. First, just want to start by saying that the information that I'll be sharing has been provided by our Medical Services Division, and for reference, our sworn staff don't have involvement in the COVID-19 vaccination process other than providing security for our medical staff. First, all our incarcerated persons are asked if they would like to receive a COVID-19 vaccination during the booking process. Incarcerated persons may request which COVID-19 vaccination they would like to receive. They are then scheduled to receive a vaccination on the next scheduled vaccination date, which are scheduled 3 times a week. While in intake and during any subsequent medical encounter, unvaccinated incarcerated persons are counseled by our medical staff on the importance of receiving the COVID-19 vaccination. Incarcerated persons are offered informational fact sheets pertaining to the vaccinations during scheduled vaccination dates, and these fact sheets have been sourced from the FDA or vaccine manufacturer websites. If an incarcerated person refuses a COVID-19 vaccination due to already being vaccinated, this will be recorded and documented by our medical staff. Medical staff cannot definitively determine if an incarcerated person was vaccinated out of custody unless that person chooses to share that information with our medical staff. If an incarcerated person refuses a vaccination, they can request it later during a scheduled medical encounter or by submitting an inmate request form. For boosters and vaccinations requiring second doses, our incarcerated persons will be scheduled to receive a dose at prescribed timeframes. Although our jail population is continually changing, our Medical Services Division reports approximately 43% of our inmate population has been vaccinated against COVID-19. And it is unknown what percentage of the jail population has been vaccinated out of custody and has not reported that information to our medical staff. Medical Service Division has recently partnered, well, not recently, March 2021, partnered with the San Diego County Health and Human Services Agency to host mass vaccination events at our facilities. At these mass events, COVID-19 vaccinations, booster shots, and flu shots are offered to all inmates. And mass vaccination offerings began in March 2021 and have been conducted continuously since then, to include 5 being scheduled within the last 30 days. Persons booked into our sheriff facilities are encouraged to take a COVID test. They ultimately have the right to refuse this. However, our health staff counsel those that refuse the test and collect a signed refusal form. Our Medical Services Division reports that approximately 85% of those coming into our custody do take part in the COVID testing process. All newly arrested inmates are quarantined for 7 days in designated housing and are housed with those inmates who came into custody during the same timeframe as them. And that's considered a COVID contact group. Inmates in our 7-day quarantine are monitored daily by our health staff for signs and symptoms of COVID-19. With that said, that concludes the information that our Medical Service Division has prepared for this presentation. Thank you.
Thank you for that presentation, Sergeant Dennis. I know there's been a lot of interest and concern over this, so I find it to be very helpful. Do any of the board members have questions for Sergeant Dennis regarding his presentation? I see Ms. Domingos, Mr. Ware, and I believe Ms. Pintar, Mr. Ware. Ms. Domingos, you do not have a question?
I do have a question. I thought my hand was up. Did I put it back down?
Yes.
May I go ahead?
Yes, you can. Thank you.
Yeah, so thank you for educating us, Sergeant, on your COVID guidelines. I just have 2 questions. First one was that inmates or newly incarcerated that were about to enter the population could refuse to get COVID tests. My question specifically is, I don't understand how that, my question is how safe is that for the others who are taking the tests, and even though they quarantine for 7 days, how safe is that for the population if folks are allowed to refuse to get tested for everybody's safety?
I would have to communicate with our medical services division on that, as that is outside of my area of expertise. Yeah, I wouldn't be able to provide any further information on that.
So perhaps Sergeant Dennis, if you could look into that and then report back, if you don't mind.
And,
Yes.
and the second question was the 7 days quarantine. I was of the impression that the CDC asked for 14 days, or am I missing something? And if I'm totally off, just correct me.
Yeah, I know that timeframe has been continually changing throughout this process. And it is different for those inmates who test positive for COVID. So the 7-day quarantine is for inmates who are not showing any symptoms and are not believed to be positive with COVID. So there are different protocols if an inmate does test positive for COVID.
Then if that concludes Ms. Domingos's questions, I will move on to Mr. Ware and then Ms. Pintar. Mr. Ware, did you still have a question?
Yes, I do. Sergeant Dennis, I just have a question on, did you say that 43% of the inmates that come into your institutions have been vaccinated, or is that 43%? Because I think you mentioned that those who, you can't tell who's been vaccinated outside of custody, correct?
Yes, so we can confirm 43%, I believe was the stat, have received the vaccine. So there are potentially more inmates that have been vaccinated that we don't know about. We would only know about that if during the intake process or at some medical encounter, they divulge that information to our medical staff.
Okay, so that 43% are those that have come into custody that you guys personally have given the vaccination to.
We have personally vaccinated or have informed our medical staff that they have previously received a vaccine.
Okay, thank you.
Thank you.
Thank you. I'll move on to Ms. Pintar.
My question was similar about the 43%, because the vaccine data report that I referenced when I asked for this information said that 70% or more had not been vaccinated. I'm just trying to sync up those two numbers. Unless that's older data and more people in custody had been vaccinated since that data was released. I think that data was only about 30 days old at the time that I asked the question, which would have been in November. So it's possible that there's just been a dramatic increase in the number of people who have been vaccinated in custody, maybe due to these mass vaccination events. Do you happen to know how to reconcile those statistics?
Yeah, I wouldn't be able to provide you definite stats on that. However, you did pinpoint there were 5 mass vaccination events that occurred within the last 30 days. And it's important to keep in mind that our population is continually changing. So the number, the percentage that I provided today could be completely different next week, and so on.
May I ask a follow-up question, Chair?
Of course.
So what I heard you say, 43% is the number is based on the people that you're vaccinating that are being vaccinated once they're in custody, whether that's at intake or in a subsequent medical, evaluation or appointment, that they are being counseled, which is new information. I don't think we knew that when we asked for this report, that they are being counseled while they're in custody. It's not just during intake. Is that correct?
That is correct.
Okay. And for those that are agreeing to be tested for COVID upon intake, is it only upon intake, or are there other times at which inmates are being tested for COVID?
To my knowledge, they are tested for COVID at intake and during the quarantine process, during that 7-day quarantine process.
And of the people that are being tested either upon intake or during quarantine, do you have a general sense of how many are testing positive? 50%, even a general number?
I don't have any stats on that at the moment, unfortunately.
Okay. And Paul, I believe that we're going to hear more information from your discussions with the county health department. Is that correct?
That is correct, but keep in mind, I will not be, I'm no kind of expert on this. I'm going
That's
to
okay. I
report
just
out on.
don't want to pepper
and I
poor
won't-
Sergeant Dennis anymore here, but yeah.
Okay, yeah, and I won't be able to answer the questions like Sergeant Dennis is,
Right.
just so you know, but all right, thank you.
Thank you.
Okay, and Pastor Spriggs, your hand was up previously. Do you no longer have a question?
I no longer have a question because someone asked the same question.
Okay, great. Then I'll move on to, and I believe Ms. Pintar, your hand is still raised, but do you have further questions before I move on?
I've lowered my hand. Thank you.
Okay, thank you. Then
I
I'll
had
move on.
one more question.
I do see you, Mr. Ware. I believe Ms. Domingos was before you, then I was going to go to you, Mr. Ware.
Thank you, Madam Chair. I'm based on Ms. Pintar's question. I do have a follow-up question. And if you don't have the answers, Sergeant Dennis, I would gratefully appreciate a response at a later date. So if an inmate should test positive and they're symptomatic, can they safely quarantine from the general population? And are they cleared by a doctor to be able to go back to the general population like we would do in the regular community, or are they different protocols?
If they test positive, they are definitely quarantined from the rest of the population until our medical staff makes the determination. And by what means, I don't have the information on. Our medical staff will make the determination when they feel that that person can safely return to the inmate population, once they feel they are no longer a risk to infect other inmates.
Is that a question that I could have answered? Like, I don't know the channels. Should I go through Mr. Parker to have the question answered? Because typically in the healthcare world, the physician would clear that person. They would have to have a negative COVID test to go back. I know the CDCs are changing their guidelines as we go, but I would love to have a response to that question.
Yeah, I can provide some more information on where I can request for our medical staff provide more information on what the protocol looks like once an inmate tests positive and how they go out of the quarantine process. So we can request that.
Thank you.
Thank you, Sergeant Dennis.
Thank you.
And then I will move on to Mr. Ware.
Sergeant Dennis, I apologize if you addressed this question already. That 43% we're talking about, are those individuals fully vaccinated and boosted, or just the first dose, or do you have that breakdown at all? Maybe that's not in your area.
To my knowledge, they are fully vaccinated. I don't know at what point they would require a booster shot. I don't have any details as far as that. But to my knowledge, the 43% includes a percentage of our population that is fully vaccinated.
Thank you.
Thank you.
I see no further questions for Sergeant Dennis, so I think this concludes his participation today. Thank you again for, as far as this goes, thank you again for your detailed explanations and fielding all the questions.
Thank you.
Okay, I'm moving on to presentation training B, which is county's role in COVID-19 vaccination of San Diego County Detention Facility inmates by CLERB Executive Officer, Mr. Paul Parker. Mr. Parker, the floor is yours.
Chair Young-Flesh, real quick before I do that, I would like to point out that as far as public comment, I did not offer or open up for public comment in front of these items. So, and it is a proper protocol to do so. I know we had public comments about things that are not on the agenda, but if there's any public comment about these COVID situation that we have on the agenda items 4A and 4B, we can open it up for that, if that's okay with you, Chair Young-Flesh. And then while I go and give my my report back. Is that okay? I'll start the report back, and if there's any public comment afterwards, we can deal with that. However, I also want to, before I do so, I want to give great thanks to Doctors McDonald, Foster, and Sayon with the county for providing, being very gracious with their time. I mean, they're all very busy when it comes to the COVID situation, and they made time to kind of straighten me out so that I provide correct information, which will be as follows, keeping in mind that I will not be able to answer any questions that come from this, as I'm nowhere near the expert. I do notice that the three people I just mentioned are in fact in the audience. And if they're willing to do so and have the time, if there are any questions, they would be the best folks to address those to if they're willing and able to answer them for us tonight without putting them on the spot, of course. So I will just say, the county's Health and Human Services Agency Medical Care Services Division has no direct jurisdiction over the detention facilities. There's been increased involvement with justice-involved populations, and the Medical Care Services Division communicates with Public Health Services and the Sheriff's Department Medical, reference outbreaks and mitigation efforts within the detention facilities. There is a San Diego immunization registry, and checking the county's immunization registry is a manual process for sheriff's medical staff. The Public Health Services Immunization Registry team has set up a process with the sheriff's medical staff to routinely automate these registry checks for the vaccination status of each inmate. Based upon the list received from Public Health Services, the Sheriff's Department medical personnel know if the inmate's due for a first shot, second shot, or booster, and offers accordingly. It's extremely important to contextualize efforts in this setting, since preventive actions may take a backseat to the obvious acute needs that occur at booking. There may be some staffing challenges pertaining to detention facility medical personnel. Public health nurses worked very closely with detention medical staff early on and provided training, and they currently assist with offering vaccinations and helping to build capacity on jail medical teams. As far as COVID testing during intake, HHSA understanding from communications with the Sheriff's Department is that the overwhelming majority of inmates are accepting testing during intake. Additional inmates are accepting testing after intake than even a few months ago, thanks to the heightened efforts by the Sheriff's Department staff. COVID vaccinations are offered during intake and then periodically while in custody, as you've already heard, and the inmate can request vaccination as well. Monoclonal antibodies are offered for those who are COVID-19 positive and eligible. Please note, these antibodies are less effective against the Omicron variant, and new guidelines have been recently published by the NIH. COVID-19 vaccines are not the only ones offered to inmates, and I think people forget that. They're also the flu and Hep A are also offered. Vaccines in general have a low acceptance rate, primarily due to lack of trust or no sense of need by the inmate. Inmates may be more from underserved communities, as identified by the Healthy Places Index. They might be younger, not have any known medical issues, thus resulting in lower vaccine acceptance. The big challenge is to develop trust in a short amount of time. There are repeated interventions with each inmate, sometimes dozens for an inmate. Motivational interviewing is an evidence-based approach that can and likely is utilized to basically meet people where they are. Medical personnel can't be pushy about this. They must identify what's important to the inmate, at which time a connection is more likely. Medical personnel must also attempt to understand the barriers and fears, and the conversations must take place in private, not in the presence of other inmates. Obviously, as the pandemic has progressed, these conversations are much more difficult. That is the extent. Oh, no, it's not. As far as the difficult conversations, people are exposed to and believe misinformation. The beliefs are well formed and their opinions have become hardened over time. And finally, everyone who is vaccinated is provided a vaccine information statement, which explains the risks and benefits. And those vaccine information statements will be linked to our minutes for this meeting. That concludes my my report back. Chair Youngflesh.
Thank you, Mr. Parker. I see that Mr. Ware's hand is raised.
Yes, I just want to have a comment real quick. Thank you, Mr. Parker. That was an excellent report. Great information. And I just had one question on the Sheriff Department's medical staff and their jurisdiction. Do they come under county health and I just don't know where they come, who supervises them or has jurisdiction over them? Because I know those doctors you mentioned, I had the privilege of watching their expertise 15 months during the initial part of the pandemic, especially. I worked very closely with Dr. Seon, and those guys are excellent. So I feel very confident if the sheriff's medical staff are coming under their jurisdiction. I just had a question on that.
Well, I think it's best that I refer to Sergeant Dennis, but my understanding is no, they don't have direct jurisdiction over the detention facilities. The detention facilities have a chief medical officer, Dr. Montgomery. So that's the extent of my knowledge, but Sergeant Dennis, if I'm wrong, or if anybody wants to correct me with that statement.
Yeah, Mr. Parker, I believe the information that you just stated is accurate, that the County Health and Human Services Agency is a completely different entity than our medical services division. There are some instances where they will work together, but they don't, there's no structure where one is higher than the other.
Okay, thank you. And Ms. Pintar?
Yeah, thank you. Just to be clear, so I understand that there's a chief medical officer for the sheriff's department that is oversees medical care and medical services at the jails, correct? Is that correct, Sergeant Dennis?
Yes.
And the vaccine clinics and the vaccination counseling that's being provided at the jails, is that being provided by the sheriff's chief medical officer or by the county HHS? And I'll tell you why I'm asking this question once you answer.
So the mass vaccination events that are being conducted within our facilities, those are coordinated with Health and Human Services Agency. Our department still has control over, our medical service division still has control over the vaccine process within our custody or sheriff's custody. However, they feel that working with Health and Human Services Agency has brought some methods that were utilized on the outside with the general public into our facilities through the collaboration.
Thank you. That's exactly why I was asking, and why I had asked about this previously is because the county has done such a good job of getting to, you know, a good vaccination rate within the county. And so it seemed like they would be able to provide some additional assistance. I had another question, Chair Youngfish, and I forgot it. So I will put my hand down and defer.
Okay, well, Ms. Domingos's hand is up. And so if Ms. Pintar, if you remember your question, just please raise your hand again. We'll call on you. Thank you. Ms. Domingos?
Yeah, I do have a quick question. I just wanted to piggyback off Ms. Pintar again. Just out of curiosity, are the inmates offered incentives for getting tested or getting vaccinated, Sergeant Dennis?
Not at this time, no.
And then I was not sure, Madam Chair, what your, I'm still learning all of this, but I'm looking at the community members side, and I noticed that at least 3-4 hands have their hands up. I can't tell if they forgot to lower their hands, if they want to speak.
I believe Mr. Parker addressed that. He said that he was going to open it up for public comment, or he suggested we open it up for public comment after the board members ask their questions.
Okay,
so,
I must have missed that. Thank you.
Yes, Chair Youngflesh, thank you for that. I do note that there are several members of the public that want to comment, and we will open that up here as soon as the board is finished. Thank you. And also, I will let you know, Chair Youngflesh, that Dr. Sayone, Dr. T, with the Health and Human Services Agency, has graciously volunteered to answer any questions as well, and he is able to do so if need be. And that's one of the folks that I had talked to get my information.
Oh, wonderful. That's
so
great.
I mean, I think we probably should obviously let the public speak first before any questions are directed to him. That would be my recommendation, Chair Youngflesh.
I would agree with that. So if the board members have further questions for Sergeant Dennis, I would go ahead and ask that you raise your hand now, and then we'll have the public comment and then have any questions directed towards the presenter who's willing to speak. So Ms. Pintar, did you remember your question?
I did. We are focused on vaccines for this item, which I appreciate and understand. That's what's on the agenda. If this has been addressed previously before I joined, I just would like to know at some point the greater context of other COVID protocols as it relates to masking and quarantining. I don't feel like we got a super clear answer on how people are quarantined. Is it in a separate cell? Are they away from everybody else? I believe Ms. Domingos asked for that information, and maybe additional COVID protocols could be included when that returns to us.
Yeah, I can definitely request that information along with the protocols for inmates who test positive. I can go over the basic protocols for quarantining when inmates come into custody.
Okay, and then my last question, and I don't know if this would be for the Chief Medical Officer for Sergeant Dennis, but Mr. Parker mentioned the county vaccine registry. Did you say whether or not inmates are being cross-checked with the vaccine registry and if their information is being input into the vaccine registry? I know the county really relies upon that for vaccine data. And it would be useful to know too, is, you know, if we see COVID positive, you know, people getting sick in the jails, if they've been vaccinated and boosted. So my question is whether the county's vaccine registry is being cross-referenced when people are brought into intake.
That is not something that I have any information on. I could follow up on that as well.
I think the best person to comment on that, quite frankly, Sergeant Dennis and Ms. Pintari, is Dr. Sayum, who's here right now, and Chair Youngflesh, with your permission, perhaps he can answer that question.
That'd be wonderful. I'm happy that he is here. Thank you for coming and being willing to participate, Dr. Sayum.
Of course. Good evening, everyone. And I do want to say, I know my wonderful colleagues, Dr. Foster and McDonald, are maybe in the audience too, in case they want to chime in. But with regards to the San Diego Immunization Registry, that is housed in Public Health Services and Health and Human Services. And you're absolutely right, Ms. Pintar, that we do strongly rely on that in a lot of our data. And then if someone is vaccinated outside at a community site, a community clinic, a hospital, maybe an emergency department, whatever, you know, hopefully those records are entered into the registry, and a lot of places have automated entry nowadays. And then that is available to the Sheriff's Department. So the Sheriff's Department does have access to the registry. But as Paul mentioned in his briefing, you know, that is a very manual process. And so, and just the volume of inmates that you all deal with, or the Sheriff's Department deals with, you know, on top of all of their other tasks, this is one extra additional task. So what we did is we set up an automated, a secure SharePoint or folder where they're able to securely give a weekly list of new inmates. And then the registry staff are able to run that through the list and then see if, you know, I'm just going to say John Doe, you know, needs vaccine number 1, or if maybe he needs number 2, or maybe he's due for a booster. So they know exactly which one he's due for, and then they can go then back to John Doe and see if he's willing to accept that.
Thank you. That's exactly what I wanted to know. I appreciate it.
Mm-hmm. Chair Youngflesh, if there are no other questions from the board, I would like to open it up to public comment before we move forward.
Yes, that'd be great. Are there any? I don't see any other questions. Do any other board members have any questions? No. I think. Okay, seeing and hearing none, then I would ask Mr. Parker to open up to public comment regarding this topic.
First, we will go to Tasha Williamson. Ms. Williamson, are you there?
Yes, can you hear me?
We can hear you. Your 3 minutes to address the CLERB on this item begins now.
Okay, great. My first question for the sergeant is if the jails are going to only start again like they did during the other COVID pandemic, or during the COVID pandemic of 2020, when they started to reduce the numbers of people coming into the jail, and they were only taking certain types of crimes that were being committed and arrested for. And then the other question, kind of concern, is that we've had a number of instances where people have been arrested and gone into the jail, contracted COVID, and we also have someone who is currently there right now that has been misgendered and has been harmed. So we are starting a litigation regarding that. So I'm not sure that I have a question, but I just want to know, like, are you guys going to talk about your good and your bad when you come before this CLERB board and the public? Because it does sound good, but there's also a lot of things that are going on that this CLERB and this public needs to know about that you don't seem to mention. Thank you.
Thank you.
Mr. Parker, before we go on, I'd just like to remind the public speakers who are giving public comment that although this is their time to make comment. It is not something that we can interact with and then go back to them on, or the presenters cannot address. So I know that Ms. Williamson's had some questions, and I appreciate that. However, with public comment, it is just merely that is comment by the public. Thank you. Mr. Parker?
Next, we will go to Robin Sales. Ms. Sales, are you there? Ms. Sales, are you there?
Yes, can you hear me?
We can hear you. Your 3 minutes to address the CLERB on this topic starts now.
Well, I would like the CLERB to ask Sergeant Dennis, since we can't ask him directly, what percentage of sworn staff is fully vaccinated and boosted? What percentage of the civilian staff at the detention facilities, I'm talking about at the facilities, are fully vaccinated and boosted? And what is the protocol for testing for the staff at the detention facilities? So I would appreciate if you could ask those questions. Thank you.
Thank you, Ms. Sales. Next, we will go to David Myers. Mr. Myers, are you there?
Yes, thank you. Thank you, Mr. Parker. Thank you, members. And just questions for the board members to be aware of and ask in the future, and definitely look for the metrics. The metrics, especially for the time period in which the department claimed that there were vaccination rates and the percentage of testing that was done during what time period. And also something to look for when how does those vaccination rates and the department's claim to separate COVID positive individuals with how the inmate classification system is working? Because the jail only has so many beds, so many cells. So if your classification system is breaking down because you're trying to separate COVID positive inmates, then what you do is you have problems where you have somebody booked in on a misdemeanor trespassing charge in a cell with somebody who's extremely violent, and then on Christmas Eve in 2020, you get the cellmate beaten to death. So that is a huge problem within the classification system, is then what do you do with positive inmates? And then look at your inmate workers. What happens to inmate workers when you separate them? Because you have to house them in different parts of the jail system. And if your inmate worker population is COVID positive or not vaccinated, that's a real concern. Also, your metrics on how many times does the department, when individuals are booked into jail, is the systems that the doctor previously testified to that the department has access to? How many times has the department actually verified, accessed the system to determine first shot, second shot, booster shot, COVID positive? And then what happens? If you get a COVID positive test on an inmate and they bail out, is there follow-up? Do you follow up? Does anybody follow up with that COVID positive inmate to at least notify them, notify relatives, and look at those metrics? There's a lot of information you did not receive, and it's imperative that when you make your decisions that you have all the information. Thank you.
Thank you. And next, we will go to Ms. Lori Saldana. Ms. Saldana, are you there?
Yes, I am. Thank you. And to follow up on some of the previous statements, I realize that we can't ask questions that will be answered. So I'll put this in the form of a statement that it's, as someone who has participated in some hearings in my career, not coming forward with a percentage of people in jail with COVID is unacceptable. It's just unacceptable. That should be immediately in the front of this report. When you have a high rate of infections, especially now with the most infectious variant we've seen, and you have people that are often chronically unsheltered or housing insecure, the county health department has noted that a person who is unsheltered and has COVID is twice as likely to die and 5 times as likely to need hospitalization. So what you're dealing with in the jail population are often people who have been housing insecure or unsheltered, and that could contribute to a much higher rate of needed medical care, a much more acute necessity of care. And you also are dealing with people who are twice as likely to die. And given the track record in the jails of people already dying in custody, I think if you're not following these metrics, as Commander Myers mentioned, and you're not looking at who are we bringing in, what is their circumstance, how likely are they to need medical care, can we put them into a separate area with acute medical supervision? I mean, those are the kinds of things that you need to save lives in custody of people who are testing positive for COVID. And the most basic number is what percentage are being tested positive for COVID out of that population of people arrested. So I would like to say I appreciate the report, but there are glaring holes in the information that's been provided to you to determine if the best care is being given to inmates who are testing positive for COVID, and that could contribute to more in custody deaths. Thank you.
Okay, thank you. And that, Chair Youngflesh, concludes members of the public comment on items 4A and 4B.
Thank you, Mr. Parker, and thank you to the public who contributed today, as well as Dr. Sayon. Accordingly, now that we've concluded public comment, I'll move on to Executive Officer's Report, which is agenda item number 5, and turn the floor back to Mr. Parker.
Thank you so very much. And as far as the first thing I'd like to say as part of the Executive Officer's Report is I want to thank again Drs. Sayon and McDonald and Foster for their assistance and their willingness to provide clarification. I also think it's imperative that we thank Sergeant Dennis and Sergeant Brayman and the Sheriff's Department themselves for their willingness to come here to discuss this topic. They understand the criticalness of it, and I'm glad that they've done so. They technically don't have to. Technically, they don't have to because it doesn't deal with sworn personnel. So I think that that's important. I appreciate that, and I appreciate their willingness to continue to follow up and provide the public this critical information using our forum to do so. So thank you for all involved with these conversations. So what I'd like to start with is say that yesterday, William Graham started as a new CLERB special investigator, thus filling the final special investigator vacancy. And I would like to turn it over to him just to give a little overview of his background and to welcome him on to CLERB. Let's see where he is. Are you there, Will? There you are. All right, Will, the floor is yours for just a couple seconds. Give an overview of yourself, and that's it. Go ahead.
Okay. Good evening, board members. Again, my name is William Graham. I'm retired LA County Sheriff's Department, 22 years with LA County Sheriffs. I also worked for Riverside Public Defender's Office. I worked their capital murder and death penalty cases. And essentially I was put in charge of the mitigation fact phase part of the investigation. I worked there for approximately 2 years, and at which time I ended up working with the California State Bar as a special investigator, conducting investigations related to attorney misconduct and fraud. Upon my time with the State Bar, ended up going with working for the San Diego City Attorney's Office, where I conducted investigations related to attorney misconduct. Domestic violence, sex crimes, child abuse cases, and I later went on to working the ethics unit, where I conducted investigations related to law enforcement misconduct for the city. And I'm currently with the CLERB unit.
Thank you, Will. Obviously, as you can hear from Mr. Graham's background, I mean, a wealth of information, knowledge, and experience. I'm extremely excited to welcome him to the board. I have a feeling he's gonna help us tremendously. We're gonna learn from him as he learns from us. And so again, Will, welcome.
Welcome, Will.
Thank you, sir. Thank you.
Welcome.
All right,
Thank you.
And moving on, and I'm not going to put her on the spot, but Eliza Hugie, those of you that were with the board last year from December through March, remember Eliza. Eliza stepped in to assist Tamika. Eliza's back. She started today. She'll be filling in, assisting with temporary administrative support, assisting Tamika, who will be basically looking to, it looks like Tamika will be retiring from CLERB in the next couple of months, and that's not confidential information or anything like that. It's something that that we don't want to happen, but it looks like that's what's going to be happening. So in the interim, Eliza will be here learning everything she can from Tamika as long as we can, and then we'll move forward with the filling of Tamika's position when it actually becomes vacant, and then move on. But we'll talk more about Tamika and all her assistance that she's provided to us over the years when the time is right. But I wanted to welcome Eliza back. And in reference to some of the comments that were made, the California State Auditor's audit of CLERB has been completed, and many folks in the public session or on public comment obviously have noted that that's an item on tonight's closed session agenda. It's a draft report. So the draft report and our CLERB's proposed response has also been drafted by me. It will be presented in tonight's closed session to the CLERB board for finalization. When the final California State Auditor's report is issued, it'll be placed. What I plan to do is place it on a future CLERB open session agenda, perhaps as early as next month. I'll do what the CLERB wants, though, when it comes to